Doctors have long been increasingly rated by health insurance companies, but suddenly doctors are turning the table on the health plans themselves. Welcome to XM 157, ReachMD, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter for the Chicago Tribune, and with me today is Dr. William Dolan. He's a board of trustee with the American Medical Association. Dr. Dolan is an orthopedic surgeon from Rochester, New York. He was first elected to the American Medical Association Board of Trustees in June of 2007. In his role at the AMA, he is currently helping them head up this first ever National Health Insurance Report Card. Dr. Dolan, welcome to ReachMD XM 157.
Thank you very much. Appreciate it.
Well, it's so great to have you here because I've done many shows and written a lot of articles about these efforts by the health plans and the employers. They all want to rate the doctors on everything from the cleanliness of their offices to whether they give aspirin after a heart attack, which that sort of is an interesting thing that doctors are having to subject themselves to be prepared for the consumers. But now the AMA has launched this National Health Insurance Report Card, which is a very interesting effort that I see you're smiling here because it's probably something that doctors and consumers will be looking forward to. So if you could tell us a little bit about this.
Yes, I think the doctors and consumers will be looking forward to it because it directly affects all of them. This was no quid pro quo or no tit for tat. This is something that's been brewing for many years. The American physicians spend about $210 billion, as estimated by PNC Bank, and on billing. In other words, they spend 14% of their gross income in trying to get paid. It's just like you trying to get your salary from the Chicago Tribune, 14% of your salary, attempting to get your check. It's just not right. So with this, if we can get a fix to this and bring this 14% down to, say, 1 or 2%, then we see a tremendous cost reduction in the care of health. So you can see this would happen to the physicians would be helped, the patients would be helped, the employers would be helped, and the insurance companies would be helped. They would see a cost reduction in premiums, healthcare premiums, and the best thing of all of it is that the patients would now be able to spend more time with their doctors.
Well, that's an interesting thing that a lot of people don't understand. And, and even a lot of doctors might not understand this because they get paid from, you could be a doctor in Buffalo, New York, or Chicago, Illinois, or Los Angeles, and you could have a contract with 7 different health plans, and health plans are known to change payment rates, or they might operate on a different fiscal year even, and so a doctor might suddenly get a payment, and they're like, wait a minute, I think I'm supposed to get more for that. So I think what you're talking about is that the doctor has to look over the contract, get one of his clerical staffers, who's probably not an actuary from MIT, to go and call and deal with this hassle, which is something that probably should have been worked out by the health plan in the first place. And so I guess by rating these health plans, it sort of puts them on notice that say, hey, we're going to rate you just like maybe like an airline is rated by Consumer Reports on on-time arrivals. You want to make sure you're paid on time and at the correct amount and with the correct code, I suppose.
That's correct. You're right on. You say it as well as I say it. The physicians just want accountability, transparency, and to get rid of the black boxes. These black boxes are basically computer edits that are only known to the insurance companies. They buy them from different companies. McKesson is a big one. But they don't reveal what the edits are. It's like playing a game of baseball with one side not knowing the rules and the other side knowing the rules. So if we can share the rules, be more transparent, this will be a win-win for everybody. And this is just the start, the launch of telling America, this is what is happening with the 9 largest insurance companies in America. Now, we're also launching a campaign to help the doctors to reach out with online tools that they can reach out and get their claims more quickly. They'll also teach them how to use the complex codes. Now, most of them know that. They have business managers and other things.
And in all with codes, a lot of people don't realize there are 14,000. But a physician, I think someone was mentioning to me that a specific physician such as yourself, you might have only 20 or so codes that you might have to deal with?
As an orthopedic surgeon, I probably use 100 codes. So we know those well. We know the modifiers and how you modify a code and things like that. It's very complex. We also have joined with an electronic billing system that scrubs their edits, and we know their edits now. They know enough about these black boxes by what they're doing, and they keep their, what we call their PhD edit filers, and they know what to expect and let us know exactly how to file a clean claim all the time and not spend all the extra money on rework or refiling the claims, which is not included in this cost, the rework.
Well, if you're just joining us, or even if you're new to our channel, you're listening to XM 157, ReachMD, the channel for medical professionals. I'm Bruce Japsen of the Chicago Tribune, and joining me today is Dr. William Dolan. He is an orthopedic surgeon from Rochester, New York, but he's on the board of the American Medical Association, which has launched a first-ever effort to actually rate the health insurance plans. All sorts of other industries are being rated. Airlines, doctors themselves are being rated. But what this is an interesting effort that it does is it helps the physician actually be paid appropriately for a contract that's already signed. But broader than that, doctor, if you could tell us, for the consumer, I'm a consumer. Everybody, provided they have health insurance in this country, they're seeing higher deductibles. And so my guess is that if a doctor is getting paid 86 cents on the dollar for an edit that wasn't made properly by a health insurance company, that could affect the consumer too, or certainly it would affect the doctor's ability to be able to tell the patient how much their cost is going to be.
Absolutely. I mean, if you have a high deductible plan with most of these companies, we don't know their edits and we don't know their black boxes. We can't tell you how much you're going to have to pay out of your own pocket for a particular procedure.
Well, for example, I'll rattle off some of the names. Most of you, our listeners, would be familiar with them. Aetna or Anthem, Blue Cross Blue Shield, Cigna, Coventry, HealthNet, Humana, United Healthcare, and even the Medicare program, and how well they're doing on these measures. For example, contracted payment rate adherence. So basically, if they're paying according to the terms of the contract, they rate between 70 and 98%. Well, that's a C minus or better. So in Aetna's example, they are probably paying 30% of the time in this instance, they might not be paying appropriately. And in that scenario, if you have a high deductible plan, there's a fairly good likelihood that the patient might end up, not knowing exactly what the payment is, or at least the doctor wouldn't be able to tell them.
No. And, there's one plan, as you know by the report card, and all your listeners can get this on the web, on the AMA website, that one plan files correctly on the contracted rate only 66% of the times. So that's 2/3 and a 1/3 error. It's like a patient going to an ATM machine. You go to an ATM machine, and here 66% of the time, you don't get the money you want out, 66 to 86% of the time. Well, that's not right. And 3 to 12% of the time, you put in your amount that you want to get out, and you don't get anything out.
For information, actually, before we wrap up, I want to be able to list off this website. It's www.ama-assn.org, which is the AMA's website. And then you can do a /go/cure for claims. It's the Cure for Claims campaign. And the interesting thing going forward, what are you hearing from the health insurance plans? Because I understand that the AMA did let them know that they were doing this. This was sort of a randomized claims analysis using millions of claims to come up with this database. It seems like usually doctors and health insurers have an adversarial relationship, but the AMA did tell the plans that they were doing this.
We've told them that we have been going to analyze their claims. You have to remember that doctors over the years have been in lawsuits with the different companies, and the companies settled. They know they were wrong. So right now, they know this is out there. Now, we're not going to use this to attack. We want to use it in a positive mode. In other words, let's come to sit at a table. Let's be transparent. Let's be fair. Get rid of the black boxes. Let the doctors know your edits, and you'll win. The patients will win for the most part. That's the most important thing.
And when you think about it, we have a presidential election coming up in November, Congress, etc., the push by everybody, whether it's an employer or even the health insurers, everybody wants transparency. They want to know. I think one of the sort of crazy things, if for any patient out there reading their medical bill, they look at the prices, they look at the charges, they can't make heads or tails out of it. And so I think one of the people associated with this effort said, hey, listen, if the patient doesn't understand the bill, the doctor certainly doesn't understand the payment. And it's really all related, isn't it, doctor?
It's all related, absolutely. And it has to be fixed.
Mm-hmm. And are there any sort of similar legislative efforts? I mean, I would think that this would, if the AMA is doing something like this and calling attention to these payment discrepancies, that might gather some attention of some policymakers, perhaps in Washington.
It should. I mean, it depends upon the cooperation we get from AHIP, the Association of Health Insurers. If we all want to get together and let's clean up this act, fine. In Rochester, New York, an Excelis corporation was sued by the State Medical Society when I was president. Eventually, they settled, and they promised forevermore to adhere to the CPT codes, current procedural terminology codes, which in all their claims. So they would follow the rules and not use the black boxes.
Well, in some of the key findings of the report that the AMA put out, the National Health Insurer Report Card, is they talked about denials, they talked about contracted payment rate adherence, and they also talked about transparency of fees and payment policies. But another key thing is the whole idea of pricing. This is a key facet. Pricing of healthcare would be more transparent with this. I mean, if the doctors knew what they were paid and could tell the patient, the doctors probably don't even, in effect, there would be no secrets. The patient right now would know what the doctor is paid, and then they would be able to base their cost on it, which is something everybody wants. And what's the big deal? It goes on in every other industry.
Patients are consumers, and they have to know the prices of everything they're buying. And a more informed patient is a better patient.
Well, and the other thing is, do you see this sort of broadening? I mean, I know we've seen the airline industry and the hotel industry and others, and this would be a similar effort, I would say. It's not adversarial. The hotels, the airlines, they know they're going to be rated by Consumer Reports or Zagat. So I would think that perhaps this could be successful, and the health plans would sort of look at this, and they would want to improve, especially if you have a bunch of consumers going to this website.
All right. Well, we hope they do, and it'll be good for everybody.
Well, one more time, I'd list that website. It's www.ama-assn.org/go/cure for claims. I'm Bruce Japsen of the Chicago Tribune, and we've been talking with Dr. William Dolan, a member of the AMA Board of Trustees, about the AMA's unique new health insurer report card. To listen to our on-demand library, visit us at reachmd.com, register with promo code RADIO, and receive 6 months free streaming for your home or office. If you have comments or suggestions, call us at 888-MD-XM157. And I would like to thank you today for listening.